this saw one of the first formal occasions in Italy where we present the findings from DUSE 2, because the report actually it's bulky and not easily to be summarized, but we wanted just to give you the main highlights. You know that DUSE 2 has been organized by the TFOS in order to arrive at a consensus within the scientific community, consensus that might represent several countries and regions of the world, as well as different ophthalmologists and practitioners community. And so the purpose being updating the current classification, the one, and then to clarify the etiopathogenetic mechanisms and the impact of the disease, and draw some conclusions concerning the management and the diagnosis of the disease. So the work has actually has been developed in 2 years, about 150 members from 23 countries, and there have been several subcommittees, one on pathology, the other one on diagnosis, and then there were other specific subcommittees. The report was published as a special issue of Ocular Surface in July last year, and now we will have to disseminate it in order to be fully introduced into the daily practice. So let's first of all have a look at the new definition of the dry eye that has been proposed by the user to report. The definition that was arrived at in 2007 was extremely impactful on the way in which this disease was managed locally as well as internationally. If you think about it, including the osmolarity concept and inflammation on the other side in the dry eye definition resulted in considerable repercussions in the subsequent years in the management of dry eye. First of all, dry eye was defined for the first time as a disease, and thus recognizing for the first time this as a pathology and not merely as a dysfunction of the ocular surface. This means that this problem could be taken seriously by clinicians, first of all, and especially in their relationship with the patients. Patients suffer quite a lot from this pathology, which has a strong impact on their lifestyle. And so, as a multifactorial disease in particular, and this is also very important. So 10 years ago we used to say pathology affecting the tears and the tear film, and we know how important is it to realize that dry eye is a disease of the ocular surface where the tear film and its alterations play a major role. So we may now talk about the loss of homeostasis of the tear film. And so we are, this is about symptomatic dry eye, and this is already a choice because in this way we rule out asymptomatic dry eye. And so it was decided to focus on dry eye with symptoms and affecting the daily life. So, and you know, talking about discomfort and visual disturbance isn't enough to embrace all the possible problems or issues affecting patients. And then let's come to the final part of the definition. First of all, the key point on which the definition is focused are no longer 4 but 5. So in addition addition to instability of the tear film and the hyperosmolarity, ocular surface inflammation and damage, we have the role of the neurosensory system that has also been demonstrated recently by the Carlo Del Monte's group. And so these key points have been clearly defined as etiopathogenetic mechanisms. So not only symptoms are associated to the disease, but as main and impactful factors. So this is, of course, too crowded a table to talk about it, but if you like, we can focus on the dryness sensation, which includes the exact explanation of the role of receptors, not only in the pathology, but also in regulating the basal tears or tear mechanisms. And these are corneal receptors, of course. Let's have a look at the grading system or classification. So here there have been a few novelties introduced. At the bottom in particular, you may see that the evaporative forms and the aqueous deficient forms are no longer separated, separate one from the other, but they are both made closer to evaporative forms. So all dry eye forms are potentially evaporative, and there is a very strong overlapping between the two forms of the disease. And here, it was our investigations were guided by the questions, triaging questions. On the one hand, we have the presence of symptoms as a screening test, and two questionnaires, OSDI or DAQ5, were used with a positive threshold, plus some clinical tests. On the one hand, we have the stability of the tear film and the tear breakup times and non-invasive tear film, but tests of the tear film. So, and it would be very interesting to understand what's the relationship between these two phenomena. The instability and the osmolarity of the tear film and the staining of the ocular surface. So it has been ruled out the assessment and quantification of the amount of water present on the ocular surface, which is quantified only at a later stage in order to distinguish between evaporative and aqueous deficient forms. And in the latter case, there are several tests mentioned, like the shimmer test and evaporative test. This is my last one, but the last slide. So this is the approach to the management of dry eye. So there isn't a therapeutic approach oriented towards the pathogenesis, but only based on the severity of disease. And the various elements are added as the severity of the disease progresses.